Hello, my name is Helen Trimble, and today I'm going to be talking about separation anxiety disorder. All of my information was researched through the Diagnostic and Statistic Manuals editions 4 and 5. I also used two other external sources from Psychology Today and Mayo Clinic. All of my resources will be cited at the end. To get started, let me begin with describing what separation anxiety disorder is. The individual with separation anxiety disorder is fearful or anxious about separation from attachment figures to a degree that is developmentally inappropriate. There is a persistent fear or anxiety about harm coming to attachment figures and events that could lead to loss or separation from attachment figures, and a reluctance to go away from attachment figures. There are also nightmares and physical symptoms of distress that contribute as well. Although the symptoms often develop in childhood, they can be expressed throughout adulthood as well. One essential trait of separation anxiety disorder is the excessive concern of the attachment figures, which fuels the anxiety of separation. Separation anxiety often develops after intense life stress, such as a death of a pet or relative, a relative or close individual falls ill, a change of schools, parental divorce, moving to a new house, immigration, or any disaster that involved in periods of separation from the attachment figure. Some additional causes for young adults experiencing separation anxiety could be leaving your parental home, entering a romantic relationship, or becoming a parent. Now on to the criteria that one needs to meet for the diagnosis of a separation anxiety. The first, there must be three or more pieces of evidence for the following symptoms. 1. The individual has a recurrent and excessive distress when they are separated from their home or major attachment figures, and this distress is anticipated. 2. They have a persistent and excessive worry about losing or about possible harm befalling their attachment figure. 3. They have a persistent and excessive worry that an event will lead to the separation of their major attachment figure. This sort of event could be getting lost or kidnapped. 4. The individual has a persistent reluctance or refusal to go to school or elsewhere due to the fear of separation. 5. They are persistently and excessively fearful or reluctant to be alone with or without a major attachment figure at home without significant adults in other settings. 6. They have a persistent reluctance or refusal to go to sleep away from home. 7. They have recurring nightmares involving the theme of separation. 8. The individual has repeated complaints of physical symptoms such as headaches, stomach aches, nausea, or vomiting. In addition, palpitations, dizziness, and feeling faint are also some physical symptoms, although they are less likely to occur in younger children, and these symptoms occur when separated from the major attachment figure or when the separation is anticipated. Next, the next criteria that needs to be met is that the fear, anxiety, or avoidance is persistent and lasting at least 4 weeks in children and adolescents, and typically 6 months in adults. Next, the onset of the disorder is before the individual is 18 years old. Next, the disturbance causes clinically significant distress or impairment in social, academic, or other important areas of functioning. The final piece of criteria that needs to be met in the disturbance is that the disturbance is not better explained by another mental disorder, such as refusing to leave home because of excessive resistance to the change in autism spectrum disorder, the delusions or hallucinations concerning separation in psychotic disorders, the refusal to go outside without a trusted companion in agoraphobia, the worries about ill health or other harm befalling their significant other in generalized anxiety disorder, or concerns about having an illness in illness anxiety disorder. Now turning to the epidemiology of separation anxiety. Who is affected? There seems to be no racial or cultural influence on this disorder. The only thing that must be kept in mind is that some cultures highly value strong interdependence among family members. Thus, there is a social and cultural acceptance behind not moving out when you're an adult. However, anyone of any age may develop separation anxiety. Although it is more common in younger ages, as seen in a study of a 12-month prevalence of separation anxiety that was taken in the United States, where adults had the prevalence percent of 0.9 to 1.9. Adolescents, there was a 1.6%, and in children there was an estimated prevalence of 4%. From this study, the most affected were children younger than 12 years old. And due to some other studies, there may be some genetical links between separation anxiety disorder. First off, separation anxiety is more common in first-degree biological relatives and may be more frequent in children of mothers with panic disorders. Next, during a community sample of 6-year-old twins, it was determined that heritability of separation anxiety was estimated at 73%, with higher rates in girls, meaning that the separation anxiety in children may be heritable. It was also found that children with separation anxiety disorder displayed a particularly enhanced sensitivity to respirator simulations using CO2-enriched air. Taking a look at gender differences, it is noted that adolescent males tend to deny their anxiety about separation, but their anxiety may be reflected in their lack of eagerness to do activities alone and reluctance to leave home. Meanwhile, clinical study samples of the disorder show an equal commonality between males and females. Yet in epidemiological samples, the disorder is more frequent in females. Due to the fact that clinical samples use biological material from those with separation anxiety disorder, and epidemiological samples are based on surveys taken out of a population, the skewedness of these samples may be because most adolescent males deny their anxiety separation. Finally, one last comment. Children diagnosed with separation anxiety disorder do tend to come from tight-knit families, and the disorder manifests itself differently at different ages. Since we have now covered a good base of what separation anxiety is and who it affects, I will now talk a little bit about the development and course of this disorder. First, let me mention that it is part of our normal early development to experience heightened separation anxiety from attachment figures, and this may even indicate the development of secure attachment in relationships. However, the early onset of separation anxiety can be as early as preschool age and can occur any time during childhood and rarely in adolescence. This may persist throughout adulthood. In fact, many adults who do suffer from separation anxiety usually do not recall children onset of separation anxiety, however, they may recall the symptoms. Younger children with separation anxiety may not express specific fears, but the older they get, they can depict their worries and fears of threats to their parents, home, or themselves. A few examples of children's worries who fear would be a fear of animals or monsters in the dark. The older children may see the threats as muggers, burglars, kidnappers, car accidents, and planes. Adults with this disorder tend to be overly concerned with their own children and spouses. Separation anxiety in adults may also limit their ability to cope with changes in circumstances, such as moving or getting married. They may also experience significant disruptions at work or social experiences because of their needing to continuously check on the whereabouts of their significant others. Meanwhile, some function consequences that come about during the development of separation anxiety in children are not attending camps, difficulty sleeping alone, and avoiding school. While in adolescence, one is not going away for college, and that is the main consequence. And in adults, not leaving their parental homes, not traveling, and not working outside of their home are some more common consequences. Moving on to differential diagnosis and comorbidity, let us first focus on differential diagnosis. Here are a few disorders which seem to correlate with some of the separation anxiety disorder symptoms and the reason for their difference. First, we have pervasive development disorder and schizophrenia and other psychotic disorders. Now, if symptoms of separation anxiety occur only during one of these disorders, then the second diagnosis of separation anxiety is not given. The hallucinations for the psychotic disorders may be assumed if a child claims to have a monster in their room at night. This would not fall under the category of hallucinations. It is merely a misperception of certain stimuli in a particular situation. And the anxiety brought on by this misperception is reversed by the presence of an attached figure. Second is post-traumatic stress disorder, or PTSD. The main difference under the fear of separation from loved ones and PTSD is that the central symptom of PTSD is the concern from intrusions about memories associated with the traumatic event itself. Whereas in separation anxiety disorder, the worries and avoidances concern the well-being of the attached figure and the separation from them. Next is the anxiety disorder agoraphobia. Separation anxiety can be best differentiated from agoraphobia by examining cognitive ideation. In separation anxiety, the thoughts are about detached from significant others and the home environment, whereas in agoraphobia, the focus is on panic-like symptoms or other incapacitating or embarrassing symptoms in the feared situations. Fourth, social phobia. Social phobia would be warranted when a child displays signs of fear or discomfort in social situations occurring at home, while children with separation anxiety are generally comfortable in social settings in their own home or in the presence of their attached figures. Fifth, specific phobia. Specific phobia would not be warranted if the situations feared are not due to the separation from an attached figure. Next, conduct disorder. Although children with separation anxiety disorder may refuse to attend school, the cause of this truancy is out of fear from their attached figures and therefore does not qualify for conduct disorder. Next, generalized anxiety disorder and panic disorder. Although the fear of or threats of separation may lead to extreme anxiety and even panic attacks, this is different than more common panic disorders because the anxiety concerns separation from attachment figures or from home rather than being incapacitated by an unexpected panic attack. Finally, personality disorders. The first personality disorder I will mention will be dependent personality disorder. This disorder is characterized by an indiscriminate tendency to rely on others, whereas separation anxiety disorder involves concern about the proximity and safety of their main attachment figures. The second personality disorder I'll mention is borderline personality disorder. This is characterized by a fear of abandonment by loved ones. But the problems of identity, self-direction, interpersonal functioning, and impulsivity are additionally central to this disorder, whereas they are not central to separation anxiety disorder. Now on to comorbidity. Some of the main comorbidity disorders with separation anxiety are generalized anxiety disorders such as specific phobia and social phobia, PTSD, panic disorders, social anxiety, agoraphobia, obsessive compulsive disorder or OCD, personality disorders, and depressive and bipolar disorders. The next and final portion of my presentation of separation anxiety disorders is the therapy and treatments that can be found for this disorder. To begin, the goal of any treatment for separation anxiety is to resolve the feelings of separation anxiety, and in order to first accomplish this, the individual must develop a sufficient sense of safety and trust in their attached figure's return. Some therapies and techniques for anyone with separation anxiety are psychotherapy, which is generally cognitive behavioral therapy or CBT, as well as changes in parenting, family education, family therapy, and in older children and adults, SSRIs or antidepressants may be prescribed in order to help severe symptoms. I hope you enjoyed my presentation and got to learn some new and interesting things about separation anxiety disorder. Thank you.